I will also discuss few of the spaces in the scapular region. Okay. So, okay. So let me just check. So students, okay. Please let me know I am audible. Okay. Okay, dear students. Okay, you can just message me any doubt. If you are not understanding anything, you can just message me in the chat box. Okay, perfect. Okay, so the first thing before starting exactly the session, okay, so yes, Sakshi, okay, so we can start. Good to go. Okay, so before exactly starting the session about the important muscles in this area, important structures lying there, and important anatomical reasons in the scapula and the back, I would like to tell you about the bony landmarks. You should understand few of the bony landmarks which will help you to understand the topic better. So let me just show you this images. So basically this is an image which is showing the scapula. So we have got different views of the scapula. We can see the scapula from the posterior view. We can appreciate the scapula from the anterior view and also the lateral view. So here, if I'm talking about the posterior view, you can see the spine of the scapula. This is the spine of scapula, which is evident. If you want, I can just enlarge this image. So I'm enlarging it so that you can get a better idea. So this is the spine of scapula. Also, you can see the acromial process here. And this whole process which you are seeing is the spine of scapula, which is visible here. This is the spine of scapula, and you can appreciate the acromial process. So this spine of scapula will divide the posterior surface of scapula into the supraspinous fossa and that of supraspinous fossa and that of infraspinous fossa, as you can see. Also, we can see the infraglenoid tubercle here. We can also appreciate the lateral border. Okay. Yes, good evening, Osama. Okay. Now, exactly this is again another view, that is the anterior view of the scapula. And in the anterior view of the scapula, you can see the glenoid cavity, which will articulate with the head of humerus to form the shoulder joint. You can also see the subscapular fossa. You can also see the inferior angle. You can see the superior border. You can see the acromial process of the scapula, the coracoid, the beak-like process. And in the general anatomy session, I have told you the coracoid process is an example of atavistic epiphysis, which is visible. And in the lateral view, we can see here the superior angle. We can see here the coracoid process. We can appreciate the acromial process. And this is the lateral border. So why it is important to see this bony landmark? Because this is giving attachment to important structures, muscles in this area. So it is important to know about this bony landmark. Now, I would also like to show you an image where you can appreciate few of the bony landmarks of the humerus bone. So let me just enlarge this. In the humerus bone, we can see the greater tubercle. You can see the greater tubercle here. Okay. We can also appreciate the surgical neck of the humerus, the anatomical neck of the humerus, which is just surrounding the, you can see close to the head of the humerus. We have got, this is the head of humerus, and close to it, we have got the anatomical neck. Also, we can see the intertubercular sulcus, the lesser tubercle. So this is the lesser tubercle and this is the greater tubercle, and the between space, you can see the intertubercular sulcus. So what I have highlighted, this is the intertubercular sulcus. So this is exactly the intertubercular sulcus. Okay. Now, also we can see the deltoid tuberosity. So actually, we can also appreciate the deltoid tuberosity, which is shown here. And this deltoid tuberosity is giving attachment to the deltoid muscle. Okay. So here one more image where showing the posterior view of the proximal part of humerus, the anatomical neck just surrounding the head of the humerus. The surgical neck is the constricted area which is at the junction of the upper and the middle part, that is the shaft and the proximal part of the humerus. We have got the greater tubercle. And why I'm showing you the greater tubercle? Because it's an important landmark which is giving attachment to three muscle: sit. What is it? S for supraspinatus muscle, I for infraspinatus muscle, and T for teres minor muscle. So these are important attachments which is on the greater tubercle. Okay. Now one more image where you can see the angles. You can see the anterior and posterior view of the scapula. You can see the acromial process very nicely. You can see the beak-like process, the coracoid process. Okay, this is an important landmark. And why coracoid process is very important, my dear students? Actually, if you remember the class of, if you remember mine class, I have told you that when I am talking about the coracoid process, it is an example of atavistic epiphysis. Also, we can see the subscapular fossa, which is like and the anterior surface or the anterior view of the scapula. Posteriorly, we have got spine of scapula, which will divide the posterior surface into upper part, that is supraspinous fossa, lower part infraspinous fossa. Also, we can see the lateral angle where we have got the glenoid fossa. We can also appreciate the superior angle and inferior angle. Okay, done. Now actually, if you want, we can see another view where you can see this is the inferior angle of the scapula, and this inferior angle of scapula is corresponding to the vertebra thoracic 7. This is the, also in this posterior view we can appreciate triangle of auscultation. So I will separately explain you the boundaries and the structures lying in the triangle of auscultation. So also we can see posterior superior iliac spine. Okay, this is the iliac crest. So why I am showing you these landmarks? Because these are few landmarks. Basically, if I talk about these few landmarks are important, which is asked in examination. So you should know superior angle of scapula is corresponding to the level of T2 thoracic vertebra, and T7. In this diagram, you can see the 7th thoracic vertebra is corresponding to the level of inferior angle of scapula. So few important bony landmarks you have to understand, that is very important. For example, if I am talking about posterior superior iliac spine, this is an important landmark, which is when you study hip bone, you will appreciate anterior and posterior superior iliac spine. The posterior superior iliac spine correspond to the level of 2nd sacral vertebra. So these are the important things which you should know. And I will just give you a list of approximate level of some of the spines on the back of the body, which is corresponding to important landmarks in the area. So please note down, my dear students, it's important for you. Okay, so exactly we should know that we should know important vertebral spine level. So one side you can write the vertebral spine and the other side you can write on the level. Is it okay? Level. Now it's important to know which structures is corresponding to which level. So basically, if I am talking about the T2 level, that is 2nd thoracic vertebra spine level, it corresponds to the level of superior angle of scapula. Superior angle of scapula. Superior angle of scapula. Okay, superior angle of scapula. Now, if I am talking about T3 level, that is the 3rd thoracic vertebra spine level, it is the level where the spine of the scapula meets the medial border. So basically, the crest of the spine of scapula meets its medial border. So it is the level where crest of spine of scapula meet its medial border. Okay. Now coming to T7 level. If I talk about T7 level, that is the spine of 7th thoracic vertebra. In the image, I have shown you that 7th thoracic vertebra corresponds to the level of inferior angle of scapula. Inferior angle of scapula. Got it? Now coming to the next two levels, that one is the 4th lumbar vertebra spine, which is corresponding to the level of highest point of iliac crest. It corresponds to the level of highest point of iliac crest. Okay. Now coming to the next S2 level. So when I talk about S2 level, it is posterior superior iliac spine. It corresponds to the level of posterior superior iliac spine. Okay, posterior superior iliac spine. Got it? So basically, this is important, and so many times MCQ has been asked from this topic, and it is also important for surface marking Viva class that you should be knowing about the vertebral levels of the back, an important level and corresponding to which structure. So this is very, very important for you to know. Now, moving ahead, I would like to describe today some of the muscles of the back. So basically, firstly, I will go with the list of posterior axio-appendicular muscles. So if you remember the first class of the bones which I have taken, osteology part, the general anatomy bone class, where I have told you about the appendicular skeleton and the axial skeleton. That is the axial skeleton lying in the midline of our body, and appendicular skeleton is the skeletons of upper limb and lower limb. So basically here, there are few muscles which is connecting the axial skeleton and appendicular skeleton, and these are the muscles of back. So these muscles of back can be categorized as superficial layer of the muscle, and then we will move on into the deep layer. So if I talk about superficial layer of the muscle, we have got following superficial layer of the muscle. These are, so if I talk about superficial group of muscles, in this list, I will describe two important muscles. The big bulky muscle, what are they? They are the trapezius and latissimus dorsi muscle. Thereafter, I will describe, after that, I would like to describe the another layer, trapezius and latissimus dorsi muscle. So when dissection sessions, you have to first remove these muscles, and then you can see the structures lying beneath it. They are levator scapulae, rhomboides major and rhomboides minor. Okay. So we will have this list of the muscle, and we have to know about these muscles. Okay. So in this diagram, we can see the trapezius, latissimus. So can you appreciate this triangular muscle shape? This is the trapezius muscle, and when we join the two side trapezius muscle, the shape is like trapezoid. So it is called as trapezius muscle. The latissimus dorsi muscle, as you can see, this is arising actually from the hip bone, and it is having several origin points. So it will arise from many important structures. The latissimus dorsi muscle, a very important muscle which you have to understand. Actually, it will also arise from thoracolumbar fascia. It will arise from the iliac crest, also from the lower ribs, it also arises from the lower ribs by fleshy slips, and then has got insertion in the humerus bone, that is intertubercular sulcus. Leave the muscle, then we will have, see, the levator scapulae muscle, then rhomboides minor and major. Always remember, minor will be above and major will be below. So one by one, I will discuss the attachment. So can you see, if you will see this image, you can appreciate this important point that this is the midline, the axial skeleton, and you can see the axial skeletons are connected by the bones surrounding. That is, it is connecting the appendicular and axial skeleton. So they are called as posterior axio-appendicular muscles. This is the reason it is called as axio-appendicular muscles. So one by one, let's see the attachment of each muscle. So first muscle which I want to explain. So I would like to firstly, this is a schematic diagram in which you can appreciate the attachment of trapezius and the latissimus dorsi muscle. So let's see this. Okay, so if I talk about trapezius muscle, so the first muscle which I want to describe is the trapezius muscle. Okay, so exactly, let me just enlarge this image. Okay. Okay, is it okay? Yeah. Clear, my dear students? Okay. So when you just focus on one muscle, that is trapezius, it is a flat, if one side of the trapezius muscle you will visualize, it is flat triangular. So you can see this flat triangular muscle is the trapezius muscle. Okay. But when we connect the trapezius muscle of both the side, the shape will be like now. It is taking origin from which bone? Clavicle bone. Okay, so basically it is attaching to the clavicle bone. So basically I would like to first tell you about origin and then insertion. Okay, so basically firstly clavicle, it is going and inserting. Firstly I will like to explain the origin, and then I will come to the insertion point. In other words, origin and insertion can be described as attachment also. Okay, so it is originating from medial 1/3 of superior nuchal line. Can you see here? So on the posterior aspect of the skull, here we have got the occipital bone, and medial 1/3, if I am talking about this medial 1/3 of superior nuchal line. So there is a superior nuchal line which is radiating from external occipital protuberance. So there is an so there is actually on the occipital bone, if you touch posteriorly, actually I am having hairs, but you can see the skeleton or the skull, and you can see is protuberance is lying, elevation is lying on the occipital bone and the skull posteriorly. That is called as external occipital protuberance. So it is attaching, it is originating from external occipital protuberance to that of the medial 1/3 of the superior nuchal line, also from ligamentum nuchae, also from the spine of seventh cervical vertebra, and from the spine of all the thoracic vertebra, that is T1, T2, all T12, all thoracic vertebra spine. So that means if I have to summarize the origin of medial part of the superior nuchal line from the seventh cervical vertebra ligamentum nuchae, from the spine of seventh cervical vertebra, from the ligamentum nuchae, and from the spine of all the thoracic vertebra, we have got 12 thoracic vertebrae. Okay, so this is about origin. Now talking about insertion, it's fibers. Now let the insertion of the trapezius muscle. So when I talk about the insertion part of the trapezius muscle, it inserts. The superior fibers will go lower down and inserts onto the lateral 1/3. So you can see the superior fibers are inserting into which part? Into the clavicle part. So it is inserting, if I talk about the superior fibers, it is inserting onto the lateral 1/3 of the clavicle posteriorly. Then coming to the acromial process of the scapula, and to the upper lip of the spine of scapula, upper lip of the crest of spine of scapula, and the lower fibers. If I talk about the lower fibers will be inserting into deltoid tubercle. Actually, deltoid tubercle is also found in the spine of scapula at the junction of medial and the middle third of the spine. So we have got a deltoid, the tubercle, and on the deltoid tubercle, the lower fibers insert. So that means the fibers of trapezius will insert into the lateral 1/3 of the clavicle in the acromial process. That is, the middle fibers will pass horizontally and will insert onto the medial margin of acromial process and to the upper lip of the crest of the spine of scapula, and the lower fibers will insert into deltoid tubercle. Where is the deltoid tubercle located? It is a bony landmark of the scapula which is located at the junction of medial and middle 1/3 of the spine of scapula. So in short, we have done with the attachment, that is origin and insertion of trapezius muscle. Is it okay? Don't worry, I will write everything. So let's again, so we have done about the trapezius muscle. If you want, we can also discuss here itself about the latissimus dorsi muscle, because in this image we have also seen the latissimus dorsi muscle. So if I just want to enlarge it, okay, the next muscle which I want to discuss is the latissimus dorsi muscle. So if I talk about latissimus dorsi muscle, it's again another bulky muscle. So latissimus dorsi muscle is arising from the spine of, actually from the spine of lower 6 thoracic vertebra. So you can see it is actually, we have got lower, so we have got lower 6 thoracic vertebra spine. From lower 6 thoracic vertebra spine, it originates. Also from the thoracolumbar fascia, posterior lamina of thoracolumbar fascia, also from the outer part of iliac crest, you can see, and also from the lower 3-4 ribs. And insertion, if you will see, in the insertion point, it becomes, you can see the fibers are inserting at a very uh, so it is having a fleshy, it is having a very big broad origin, but at the insertion point, if I talk about the insertion point, this wide latissimus dorsi muscle is actually inserting into the having an extensive origin, but if the fibers will become oblique, and this will insert into the floor of intertubercular sulcus or bicipital groove. Okay, so this is about origin insertion, which we have seen in this image. What else? Let's write it, because it's very important that you should be knowing about the origin and insertion of these muscles. So first muscle which I want everybody to note down is the trapezius muscle. So please write down the heading. Trapezius muscle. Okay, so if I talk about trapezius muscle, let's describe the origin. So the important origin of trapezius muscle, it is originating from medial third of superior nuchal line, nuchal line, the external occipital protuberance, in short EOP, ligamentum nuchae, also from the spine of C7, spine of C7, that is 7th cervical vertebra, also from the spine of all thoracic vertebra, spine of all T1 to T12 thoracic vertebra. Okay, so this is about the origin. This is about the origin of the trapezius muscle. So we are talking about trapezius muscle origin. Now moving to the insertion. So let's talk about insertion. So please write down insertion. Okay, so if I talk about insertion, the insertion of the trapezius muscle is as follows. Superior fibers. If I talk about the superior fibers, okay, so if I talk about the superior fibers insert into the lateral 1/3 of clavicle on the posterior aspect. The middle fibers which is passing, so superior fibers will drag in, will traverse in downward direction. The middle fibers will move horizontally and will insert into acromial process. To be more specific, it will insert into the medial margin of acromial process, medial margin of acromial process, and the lower fibers, which will pass upward and laterally to be insert into the deltoid tubercle, where it is inserting deltoid tubercle of scapula. Okay, so they will insert into deltoid tubercle of scapula. Okay, dear, so we have done with this, and it is very important that you should be aware about the origin insertion. So in short, we have finished, we have discussed about origin and we have discussed about the insertion of trapezius muscle, which we have also appreciated in the image. Now, next is to know the nerve supply and that of the action. Actually, trapezius muscle is a clinically also very important muscle, because so many times the question has been asked from the trapezius muscle. So it's very important that you should understand this in detail. So my dear students, if you have got any doubt, please let me know. Yes, Osama, osteology bhi complete kara do, ma'am. Sure, we will have that session also. So we will have a session also where we will have about the description of osteology part. Okay, firstly we were going with the theoretical part because exams are very near, so the student want to score a better marks in this university paper. So all these things will be asked in the viva. So let's now move on to the next detail, that is the nerve supply and the action of trapezius muscle. So let's write down nerve supply. Okay, so the nerve supply, if I'm talking about the nerve supply, it's very important to know that which are the nerves. So actually trapezius muscle is an example of hybrid muscle. So when is the term hybrid or composite is used? Hybrid and composite word is used when it is actually hybrid and composite word is used when we are talking about a muscle which is having more than one innervation. So trapezius muscle is having two innervation. It gets its innervation or nerve supply from two sources. Okay, that is an important point which you have to know. Okay, it gets nerve supply from two sources. So it is supply, it's getting nerve supply from spinal part of accessory nerve. So what do you mean by accessory nerve? The 11th cranial nerve and the spinal part, not the cranial part. And it also receives innervation from, it receives proprioceptive sensations from ventral rami of third and fourth cervical nerve. Okay, so that means it's a muscle which is having more than one nerve supply. Okay, now other than that, it's also important to know about the action of the muscle, the trapezius muscle. Let's talk about the action. So it is having multiple action to perform. Okay, so that is important. If I talk about the upper fibers of trapezius muscle, along with another muscle, levator scapulae, which I will describe, the it is elevating the shoulder like this. Can you see this? This action, elevation of shoulder, this action is done by the upper fibers of trapezius muscle, and this action is called as shrugging of shoulder. The middle fibers, along with the rhomboides muscle, is retracting the scapula. Retraction like this. It is retracting the scapula, and the lower fibers will depress the medial part of the spine of scapula, and acting when the trapezius muscle is working or acting along with serratus anterior muscle, it is involved in overhead abduction. What do you mean by overhead abduction? Abduction greater than 90 degrees. This is overhead abduction. Okay, so multiple actions are there which the trapezius muscle is performing. Please write down these actions one by one. So, okay, we will write one by one. The first action is upper fibers of trapezius muscle with levator scapulae. Then it acts with levator scapulae muscle. Along with it, it will elevate the scapula. And my dear students, a particular name is given to this elevation, that is called as shrugging of shoulder. Shrugging of shoulders. Okay, now the middle fibers. If I talk about middle fibers, the middle fibers will retract the scapula, and acting along with serratus anterior muscle. If you remember, serratus anterior muscle I have discussed already in the pectoral region, and there I have told you serratus anterior muscle is having the scapula, is actually, it is involved in overhead abduction. So it is involved in overhead abduction. So these are three primary actions. So these are three primary action which which is the action of trapezius muscle. Also, if you want to write one more action, the lower fibers of the trapezius muscle depresses medial part of spine of scapula. So all these multiple actions are performed by the trapezius muscle. Okay, so that is a very important point. Now, next muscle which I want to which I want to describe is latissimus dorsi muscle. Latissimus dorsi, which is having a wide origin and a narrow insertion. Latissimus dorsi muscle. So already in the image, I have already described latissimus dorsi. Now let's write more detail of latissimus dorsi muscle. And if you remember, it was having multiple origin. It was arising from the hip bone. It was arising from the lower 3-4 ribs. It was arising from the spine of lower 6 thoracic vertebrae. It was arising from thoracolumbar fascia. So origin, let's write origin. Origin is from spine of lower 6 thoracic vertebra, also from the posterior lamina of thoraco, also from the posterior lamina of thoracolumbar fascia. Other than that, also from the outer lip of iliac crest of the hip, outer lip of posterior part of iliac crest of hip. Lower 3 and 4 ribs, lower 3 or 4 ribs, also from inferior angle of scapula. So you can see that latissimus dorsi muscle has got multiple origin. And if I talk about insertion, so it is having an extensive origin, but at the insertion point, it is the fibers are moving laterally directed and obliquely twisted. And actually, what happens? The upper fibers will become horizontal, middle fibers oblique, and the lower fibers will become almost vertical at the insertion point, and this will insert into the floor of bicipital groove. So that happens, these fibers will curve and then they will insert into the intertubercular, into the floor of intertubercular sulcus, that is called as bicipital groove. So it ends, so that is it, when it is inserting, it will insert like a tendon, it will insert like a tendon, flattened tendon, and at insertion point it is quite narrow. Okay, so latissimus dorsi insertion. So basically it inserts into floor of bicipital groove, floor of bicipital groove, which is called as intertubercular sulcus, which is called as intertubercular sulcus. Okay, so basically you remember when we take osteology session also, there is a mnemonic, the lady between the two majors. Okay, because if I talk about the the margins, there is pectoralis major and teres major attached here, and in between the two major, in the floor of the bicipital groove or intertubercular sulcus, we have got the insertion of latissimus dorsi muscle. Okay, now coming to the nerve supply and action. So let's talk about nerve supply and action. So nerve supply. So if I talk about the nerve supply of latissimus dorsi muscle, it is actually it is getting its innervation from thoracodorsal nerve. And if you remember the class of brachial plexus, so whoever remembers, they can write in the message box. The nerve supply of the latissimus dorsi, that is nerve to latissimus dorsi, is called as thoracodorsal nerve, and it is a branch from posterior cord of brachial plexus. So nerve supply is via thoracodorsal nerve, and as we know, thoracodorsal nerve is branch of posterior cord of brachial plexus. Can anybody tell me what is the root value? That is C6. What is it? Can anybody tell me? Anyone remembers? Okay. What is the root value? C6, C7, C8 is the root value of the thoracodorsal nerve. Okay. Okay, because it's a branch from the posterior cord of brachial plexus. Now, action. Let's talk about the action. Latissimus dorsi muscle has got an action of external rotation, adduction of the humerus bone. So it is active. This muscle is active in adduction and extension, external rotation. So please write down, latissimus dorsi muscle causes adduction. Okay, it is a very important muscle which is causing adduction, and also it is involved in extension and rotations of arm. So extension and medial rotation of arm. So basically adduction, extension of arm, of shoulder joint, and medial rotation of humerus bone. So prime action is extension and the adduction. Okay, this is an important action of latissimus dorsi muscle which you have to know. So basically it is important that one of an important point about latissimus dorsi muscle is that it is also used as a musculocutaneous flap. So actually, the reason why it is used as a flap, musculocutaneous flap, is actually it is having a dominant vascular, single dominant vascular pedicles. It is receiving its arterial supply from thoracodorsal artery, and also, so basically thoracodorsal artery, if you remember, we were having subscapular artery as a branch from third part of axillary artery, which gives thoracodorsal artery. This artery is also combined by various others, thoracodorsal now. So basically, the presence of a dominant vascular pedicle make it very important source of use as a musculocutaneous flap. So that is very important point which you have to understand. Okay. So, and the other important point is, so basically you can please write down this clinical point. So one of the clinical point about this is the latissimus dorsi can be used as a musculocutaneous flap. Okay. So actually, in the case of chondrosarcoma of clavicle also, it has been used. Musculocutaneous flap has been used, made from latissimus dorsi muscle. Okay. So basically, the reason is it is having a dominant vascular pedicle from thoracodorsal artery. Okay. Now, so that is very important. Okay. Okay, now this is an important point. Now coming to another image. So actually we have completed two important superficial deep muscles of the back, that is the trapezius and latissimus dorsi. Now coming to deep posterior group of muscle, when you dissect out, when we are able to dissect out the trapezius muscle and that of latissimus dorsi on the deeper dissection, and you can see the muscles which is attached onto the medial border of scapula. So you can see this is the medial border of scapula. From above to down we have got three muscles. We have got levator scapulae muscle. This is the levator scapulae muscle. In short I am writing, this is rhomboides minor, and then we have got rhomboides major muscle. Okay, so one by one I will tell you about all these muscles. Okay, so basically these muscles are connecting the axial skeleton to that of appendicular skeleton. So levator scapulae, as you can see in this image also, it is arising from, if you will see, this is the levator scapulae muscle. If you want, I can write the full form. This muscle is levator scapulae muscle, and it is arising from atlas and axis. So that means it is arising from the transverse process of C1 and C2 cervical vertebra, and also from the posterior tubercle of the third and fourth. So you can see it is, so basically it is arising from, also from C3, also from the C3 and C4 cervical vertebra. So that means levator scapulae is originating from the transverse process of the axis and atlas vertebra, and from the posterior tubercle of the transverse process of C3 and C4 cervical vertebra, as you can see in this diagram. After that, you can see these slips will insert diagonally, and you can see it is inserting onto the medial border of scapula. So it inserts onto the upper part of the medial border of scapula. So here also you can see this is the upper part of the medial border of scapula, and these four slips will be of levator scapulae muscle is inserting here as shown in this diagram. Okay, below it we have got the rhomboides minor muscle originating from the C7 cervical spine, and below it we have got the rhomboides major muscle. So from top to lower down bottom, we have got superiorly attachment on the medial border of scapula. We will have the levator scapulae. Below it we will have rhomboides minor, and below it we will have rhomboides major. So always remember, minor will lie above the major. Minor, so minor is also children. We denote minor as children. So children are always kept above in comparison to that of major. So this is how you can remember. Okay, so these three muscle is connecting scapula with that of the axial skeleton. Okay, you can see the vertebral column is connected here. So let's move on with the origin insertion of these three muscles. So the first muscle is levator scapulae muscle. Levator scapulae muscle is a slender muscle, and it is originates. So where it originates? This muscle is originating from transverse process of atlas and axis cervical vertebra. Atlas and axis cervical vertebra. Okay, atlas and axis, you are already knowing it, and from posterior tubercle of transverse process of C3 and C4 cervical vertebra. That means origin of levator scapulae muscle. That means if I am talking about the origin part of levator scapulae muscle, it is from the upper four cervical vertebra, C1, C2, C3 and C4. Got it? Now coming to the insertion. Next is, so this is origin and next is insertion. Now, this is the superior most muscle which inserts into the medial border of scapula. So it will be inserting onto the upper part of medial border of scapula. Medial border of scapula. Okay. So basically, if you exactly know the part, so it is inserting between superior angle and the smooth medial end of the scapular spine. So basically in the medial border of scapula, the insertion of this on the medial posterior dorsal aspect of the scapula on the medial border, it, if you want to appreciate its extent of insertion, it is from superior angle of scapula to the medial end of the spine of scapula. So you can see this image. Can everybody appreciate? So exactly, let me use another color, this one. So exactly this is the extent. Okay, this is the extent from here to here. This will be the extent of, this is the extent of levator scapulae. That is from superior angle to that of, you can see here which structure lies, the spine of scapula. So just the medial end of the scapula, from on the medial border, from superior angle to that of medial extent of spine of scapula. This is spine of scapula and its medial end where it is joining with the medial border. That will be the insertion point of levator scapulae muscle. Now coming to the next one. Okay, so after this, let's complete the nerve supply and action here itself. So let's talk about nerve supply. Nerve supply of levator scapulae muscle is from, so basically it is exactly innervated by dorsal scapular nerve. So which nerve? Dorsal scapular nerve. And in the class of brachial plexus, I told you dorsal scapular nerve is having the root value of C5. Okay. And also direct branches it receives from C3 and C4 also. It also receives direct branches from C3 and C4, but the major supply is dorsal scapular nerve. Okay. The action is, it is actually elevating the, it is elevating the scapula during the movements of arm. So this is the action. It elevates the scapula during movements of arm. Now coming to the next muscle, that is the rhomboidus minor muscle. The next muscle is rhomboidus minor. Okay, rhomboidus minor muscle. So again, we have to know about origin, insertion. Are students understanding? Any doubt? I will in between check. Okay, students, if you have got any doubt, please ask me. Okay, so let's talk about rhomboidus minor muscle. So why it is called as minor? Because it lies above the major muscle, and origin is actually, if I talk about origin, it is originating from the spine of 7 cervical vertebra and also from the lower part of ligamentum nuchae. So it is originating from spine of C7 cervical vertebra and also from spine of first thoracic vertebra, T1, and also from the lower part of ligamentum nuchae. also from the lower part of ligamentum nuchae. Okay, so this is of the origin part, mainly from the spine of C7 cervical vertebra, also take it from spine of T1 and also from ligamentum nuchae. And if I talk about insertion, it is inserting into the medial border of scapula, lower to the insertion of levator scapulae muscle. So it is exactly inserting onto the triangular area close to the root of spine of scapula. So insertion. So insertion is, it is inserting onto base of triangular area close to spine of scapula, where medial border. Okay, so basically this is an important point about its if I talk about its nerve supply and action, together we will know about rhomboides major and minor action and nerve supply, because this is similar, both is having same action and same innervation. So now the next muscle is rhomboides major. So done. Now we will talk about rhomboides major muscle. Then we will talk about nerve supply. So let's write it, rhomboides major. Okay. So if I talk about rhomboides major muscle, its origin is so it is actually having the origin from the lower thoracic vertebra. So it is originating from the lower thoracic vertebra T2, T3, T2, T3, T4, and T5. So it is actually arising from the spine of T2, T3, T4, and T5 thoracic vertebrae. And obviously intervening ligaments, which is there intervening. So spine of these thoracic vertebra will have supraspinous ligament. So it will also originate from supraspinous ligament. Okay. Now coming to insertion. So insertion onto the medial border of scapula. Between root of spine and inferior angle of scapula. Okay, so we have now knowing the origin insertion of rhomboides major, minor, and levator scapulae. Levator scapulae, rhomboides major, minor, all is connecting the cervical and the thoracic vertebrae. As you can see, the part of the thoracic part of the vertebral column that is connecting the axis, atlas, T1, T2, T3, 4, and these all are connected by C1, C2, C3, C4. These are all connected to the medial border of scapula via these three muscles, which we have discussed. Now, together we have to know the nerve supply and the action of rhomboides major and minor. So finished with the rhomboides major and also done the rhomboides minor. So now please write down about nerve supply. So nerve supply of all these muscles will be similar. Okay. We have already seen in the levator scapulae that it is supplied by dorsal scapular nerve. So it is rhomboides major and minor is also supplied by dorsal scapular nerve. And what is the root value of dorsal scapular nerve? Obviously, root value is C5. Action. So if I talk about both the rhomboides muscle, both the rhomboids, major and minor, that means major and minor, they are importantly causing retraction of scapula, like this, retraction of scapula, retraction of scapula. So they cause retraction of scapula. Okay. So it's important that you should be knowing attachment of the muscles. If you are knowing the attachment, then only you are able to identify the muscle. So we are able to complete all the important muscles in this list. We are able to complete the muscles, that is the posterior axio-appendicular group of muscles. Now we will move on another set of important reasons. Okay. So we have finished this. Now, before moving into the another set of muscles which I want to describe, that that is rotator cuff muscles and all, I would also like to firstly tell you about an important anatomical reason which is called as triangle of auscultation. So actually this is a posterior view. Okay, so in this diagram we can appreciate two triangular space. The most important one which I want to describe is triangle of auscultation. So let me just mm, highlight this triangular reasons. So I'm just highlighting it with a yellow color, this triangular reason. Okay, so this triangular reason is triangle of auscultation. What is this? This is triangle of auscultation. So in the posterior on the back, we have got triangle of auscultation, which is a triangular mm, area or gap in the back of the thorax near close to the inferior angle of the scapula. So it is bounded by superior horizontal border of latissimus dorsi. So can you see inferiorly it is bounded by the muscle? You can see which muscle is this. This is latissimus dorsi muscle, and also it is bounded by medial border of, so what is this, it is also bounded by the medial border of scapula, as you can see. Okay, and infralaterally it is also bounded by that of the trapezius muscle. So we can see here is the trapezius muscle which you are seeing. This triangular gap is basically between the latissimus dorsi muscle, the medial border of scapula, and the trapezius muscle, as you can see in this diagram. And this is the boundary and the floor what lies inside. So can you see this triangular gap which is not overlapped by the muscle? There is a gap between trapezius muscle, that is the medial border of scapula, and latissimus dorsi muscle, and in the floor we have got the sixth intercostal space. Okay, so basically the upper part of the lower lobes of the lung lies deep in this area, and this area can be auscultated by the clinician. That is, so only it is called as triangle of auscultation. Now, also in the lower part, we can see the lumbar triangle. As you can see here, lumbar triangle is a triangular gap. If I talk about this triangular gap, this is called as lumbar triangle. Actually, this is the area of lumbar herniation, and it is a triangular gap which is lying lower down. Here we will have the iliac crest, that is the upper part of the hip bone, and we will have latissimus dorsi here on one side, that is posteriorly, and anterior we will have the external oblique muscle. So a triangular gap between latissimus dorsi muscle, external oblique muscle, and that of iliac crest is called as lumbar triangle. That is also called as Pittett's triangle, and this is the area of muscular weakness and through which there can be lumbar herniation. Okay, these are the two areas which you have to know. So one by one, I will come to the description. So let's firstly know about triangle of auscultation. Triangle of auscultation. So it's a triangular gap. It's a small triangular gap. It's a small triangular gap in the musculature of back, in the muscles of back, near inferior angle of scapula. Got it? Now, so boundaries. Now it is important to know which all structure is forming the boundaries of triangle of auscultation. So it is bounded by horizontal upper part of latissimus dorsi muscle. It is bounded by medial border of scapula and infralateral border of trapezius muscle. So these three muscles, so basically these three muscles is forming the boundary for the triangle of auscultation. Okay. Now, what lies in the floor? So in the floor, triangle of auscultation is related to sixth and seventh ribs, and the space which is lying there is the sixth intercostal space. So floor, if I talk about floor, the floor of this triangle is formed by sixth and seventh rib, and it is related with sixth intercostal space. So basically, what is the clinical importance of triangle of auscultation is deep to it. This area is related with the upper part of lower lobe of lung. And so when the scapula is drawn anteriorly and folded arms like this anteriorly, the clinician can hear the breath sounds. Okay. So this can be used as auscultating, and putting stethoscope in this region, the auscultation can be done. So that is the clinical importance of triangle of auscultation. Got it? Now, done. Now, the other triangular region which we have also seen was the lumbar triangle of Pittet. So, you can also write about lumbar triangle of Pittet. Okay, so if I talk about lumbar triangle of Pittet's, it is bounded by, so it is a triangular gap. It is again a triangular gap in back. So, we have got latissimus dorsi muscle. It is bounded by, so it and bounded by, what is boundaries? It is boundaries or bounded by latissimus dorsi muscle back, external oblique muscle anteriorly, external oblique muscle, and by iliac crest upper, iliac crest below. And this is an important reason because the gap will lead to lumbar herniation. If there is a muscular weakness, actually in the floor we can have the slip of internal oblique muscle, and this weakened area can be a reason for the lumbar herniation occurring in this site. So basically this is called as lumbar triangle of Pittet. Okay, so we have not come about the abdomen muscle, but this is also a gap which is lying in the lower back area, which you should know, because in the image we have seen the lumbar triangle of Pittet, and we have also seen the triangle of auscultation. Okay, done with this. Now, after this, let's go into the new set of muscles, which also is important in this region. Actually, today's topic is back and scapular region also. So in the posterior aspect of the scapula. So I would also like to describe few other muscles in this list. So let's move on to the list of the muscles which you have to know. Okay, so next is, okay, so before that, let's solve few MCQs. Okay, so here a few MCQs you have to solve. So basically, which part of the scapula is seen in infraclavicular fossa? So I just want to mark like this is one process which I will mark as B. This is one process which I will mark as A. Okay, and I will mark this as C. I will mark this as just a minute, this as C and this as D. So what is, first thing is that you have to know what is A, what is B, and what is C and D. So A is acromial process. What is A? A is acromial process. B is coracoid process of scapula. What is C? C is glenoid fossa. And what is D? D is spine of scapula. So all these are the parts of scapula. Can you see spine of scapula? So all these are parts of scapula. So we have to know which bony structure or the part of scapula is lying in infraclavicular fossa. So actually that structure is coracoid process. That structure is coracoid process. This coracoid process is lying there. So this coracoid process is located, that is a beak-like projection of the scapula, which is located in the infraclavicular fossa. So just see here. Let's come to the explanation. So three parts of the scapula felt within the infraclavicular process is the part. So the part which is seen, if I'm talking of the parts which is seen in infraclavicular fossa, is the coracoid process of the scapula. Coracoid process, as we know, is a hook-like projection which is seen exactly between or at the junction of middle and lateral third of the clavicle at that process. So actually this hook-like projection, that is coracoid process, can be palpated through the skin approximately 2 to 3 centimeter inferior to the clavicle, exactly between deltoid and pectoralis major muscle. So it is actually called as a surgeon's lighthouse. It's a crucial landmark which is importantly helping the surgeons to locate axillary vessels and infraclavicular block. For that they can locate brachial plexus. So that means it's an important, actually this was clinically very important, so I have formulated in the form of question that the coracoid process of scapula is located in the infraclavicular fossa. Exact location to be the palpation is 2 to 3 centimeter inferior to the clavicle. Okay, and that because of this palpation which can be done from the back, it is called as surgeon's lighthouse to locate the areas of axillary vessels and brachial plexus when they are going for infraclavicular block. Now, okay, so basically now exactly we have to go with more of the muscles, and then again I will come. I have not gone into the, so this is another question which you will again solve once I will finish more of the muscles attachment. So let's come to this. So this you can solve. Please mark this: nerve supply of the highlighted muscle. So this is an image in which you have to identify this highlighted muscle. So exactly you can know this is attached to C1, C2, C3 and C4 cervical vertebra. So you can identify this muscle. And if you remember, I have given you the details of this muscle. This muscle is levator scapulae muscle. Why? Because it is attached onto the medial border of scapula, extending from superior angle till the spine, medial aspect of the spine. This is the spine of scapula. So this is levator scapulae. And what is the nerve supply? The nerve supply of this muscle is dorsal scapular muscle, dorsal scapular nerve, and this muscle is levator scapulae muscle, which is attached superiorly on the medial border of scapula. Got it? So now this question also we will solve, but once let me complete the topic of scapulohumeral muscle. So now the next group of muscle, after completing the list of posterior axioappendicular muscles, we will go into the list of scapulohumeral muscle. So if I'm talking about scapulohumeral muscle, the important scapulohumeral muscles are first deltoid muscle. Then we will have supraspinatus, infraspinatus, teres minor, teres major, and also we will have the subscapularis muscle. So basically, we have to study all these muscles which is connecting the scapula and the humerus bone. So only these group of muscle are called as scapulohumeral muscle. So we will go into the details of all these muscles one by one. So the first muscle which we will start explanation is the deltoid muscle. Okay. So let's start with the deltoid muscle, a very important muscle because IM injection, intramuscular injections are given in deltoid muscle. So deltoid muscle, if you will see, please appreciate this diagram, and when you appreciate this diagram, you can appreciate the deltoid muscle is having V-shaped origin. So I'm just enlarging this. So this, let's talk about deltoid muscle. Okay. Okay. So the deltoid muscle is originating in the matter of V-shaped origin. Can you appreciate here? This red color area is in V-shaped origin. So it is actually originating from lateral 1/3 of clavicle. Okay. It is originating from lateral part of the clavicle. It is also originating from acromial process and the spine of scapula. So these three structures, that is clavicle, lateral 1/3, lateral margin of acromial process, and the spine of scapula, crest of spine of scapula. So basically these are the three parts of the deltoid muscle, which originates from three sources. Okay, and from there you can see insertion is inferiorly going towards the humerus bone into the shaft of humerus bone and to a V-shaped deltoid tuberosity of the humerus bone. So basically, V-shaped deltoid tuberosity is the part of the humerus bone which is lying on the lateral aspect of middle part of the shaft of humerus. So if you will see the humerus bone on the lateral aspect in the middle part, we have got V-shaped rough structure, V-shaped tubercle, that is deltoid tuberosity is there where the deltoid muscle inserts. Okay, so this rounded contour of the shoulder is formed by deltoid muscle. So this is about origin and insertion. Please write down about deltoid muscle. Deltoid muscle. Okay, so let's talk about origin first. So origin of deltoid muscle is in the form of V-shaped manner. Okay, it is originating from three sources: lateral 1/3 of clavicle. It is also originating from acromial process. It is also originating from the spine of scapula, crest of spine of scapula. Now, one more important point, which is a question of general anatomy, which I have explained you in the class of general anatomy muscle class, where I have explained you about unipinnate fibers, muscle fibers, morphological arrangement. I have told you about multipinnate. So basically, the clavicular part, which is originating from the clavicle lateral 1/3, the acromial part, and the spinous part of the deltoid muscle. So basically, we can also name it like this: the middle fibers are called as acromial fibers of deltoid muscle, the anterior fibers are called as the clavicular part, and the posterior fibers are called as the spinous part of the deltoid muscle. So if I talk about anterior and the posterior part of deltoid muscle, they are unipinnate, but the acromial or the middle part of the deltoid muscle is multipinnate morphologically. So you can write down this: anterior part of deltoid muscle, anterior part, that is clavicular part of deltoid muscles, is unipinnate, are unipinnate morphologically. What is the arrangement of muscle fibers? Unipinnate. Now, posterior part, which is also called as spinous part of deltoid muscle, spinous part of deltoid muscle. This is also unipinnate morphologically. If we see the muscle fibers arrangement, it is unipinnate. And what about the middle part? The middle part, which is also called as acromial part. The middle part or acromial part of deltoid muscle, if I'm talking, it is multipinnate. It is multipinnate morphologically. It is multipinnate morphologically. So done with this? Okay. Now, let's talk about insertion. Insertion of deltoid muscle. It is inserting into V-shaped deltoid tuberosity. And this V-shaped deltoid tuberosity is located where? It is located in the lateral aspect of, it is located in the lateral aspect of mid shaft of humerus, mid shaft of humerus bone. Now, the next important point is to know the nerve supply and action. So that is important. Deltoid is a muscle which is supplied by axillary nerve. And again, if you remember the class of brachial plexus, I told you axillary nerve is a branch of posterior cord of brachial plexus having the root value C5 and C6. And deltoid muscle is having a very important action to be performed, that is called as abduction of arm or shoulder joint. So it performs 15 to 90 degree of abduction of the shoulder joint. So please write down deltoid nerve supply. Nerve supply is via axillary nerve, having the root value C5 and C6, and which is a branch of posterior cord of brachial plexus. Posterior cord of brachial plexus. Now action. So actually, the most important action is that of middle fibers, that is acromial fibers, which is causing abduction of the shoulder joint, that is 15 to 90 degree. But its clavicular part, the anterior part, will also cause flexion and medial rotation of arm. And if I'm talking about the posterior part or the spinous part of the deltoid muscle, it also performs the action of extension and the lateral rotation of arm. So that means deltoid is performing multiple actions. Deltoid is performing multiple actions. So you can write down the heading, action of deltoid muscle. Action of deltoid muscles. Action of deltoid muscle, a very important point to be noted. So let's write down. Anterior part or the clavicular part of deltoid muscle is having the action. So it is performing the action of, it is flexing and medially rotating the arm. So it flexes and medially rotate the arm. Medially rotates arm. That means shoulder joint. Its posterior fibers, which is also called as the spinous fibers, which is also called as the spinous part, it is causing the action, that is it, these fibers are extensors, they are extensors and lateral rotators of arm. Lateral rotators of arm, shoulder joint. And the middle fibers, the most important action is of middle fibers, which is called as acromial fibers of deltoid muscle. And these fibers are very important action to be performed, that is, they are abductors of arm. They are abductors of arm. When I use the word abduction of arm, that means it causes 15 to 90 degree of abduction, because initiation of abduction is the action. 0 to 15 degree of abduction is done by the supraspinatus muscle. 15 to 90 degree of abduction is done by the middle or acromial fibers of deltoid, and overhead abduction is done by trapezius muscle acting along with lower fibers of trapezius muscle acting along with the serratus anterior muscle. Okay, so this is a very important point. Other than that, you should also know the commonly given in the lower half of deltoid muscle. Why? To save the injury of axillary nerve. So that is very important points. Okay. Okay, but actually, it has been seen that most commonly, the in actual clinical practice, the intramuscular injection is given in upper outer quadrant of deltoid region. So you can just note down, if we are talking deltoid region, it is utilized for IM injection to be given in upper and outer quadrant. Okay. Okay. So then done with this. Now next muscle which I want you to know is supraspinatus muscle. Okay, let's talk about supraspinatus muscle. Okay, so for that, firstly, I would like, so we have finished about deltoid muscle, which we have done. Now I want you to know about supraspinatus muscle, infraspinatus muscle, teres minor muscle, and the subscapularis muscle. Why? Because these are the, actually these are four rotator cuff muscles. So we have finished with the deltoid muscle. The other important muscles which you know is these following muscles: supraspinatus, infraspinatus, subscapularis, and teres minor muscle. So if I talk, you can see this is the posterior view of the scapula. How? Why it is the posterior view of the scapula? Because we can see the spine of scapula, and spine of scapula is seen in the posterior view. You can see above the spine of scapula, the space is supraspinous fossa. The muscle originating from this space is supraspinatus muscle. The muscle originating from the space below spine of scapula is the infraspinatus fossa, and the muscle is infraspinatus muscle. Now, the supra and infraspinatus muscle is actually this is greater tubercle of humerus bone. So this is greater tubercle, and also we will have teres minor muscle. So this is the teres minor muscle which is attached onto the lateral border of scapula. So from the lateral border of scapula, so we can see three muscles. So I just want you to appreciate these three muscles. So we can use okay, this is S for supraspinatus, this is I for infraspinatus, and this is T for teres minor muscle. So sit commonly inserts onto the greater tubercle. Commonly they are inserting onto which area? They are inserting onto the greater tubercle of humerus from above to down. So greater tubercle of humerus is having three facets: upper, middle, and lower facet. So at the upper facet, the insertion happens, supraspinatus muscle insert onto the middle facet, infraspinatus muscle inserts, and onto the lower facet, teres minor muscle inserts. Okay, supraspinatus originating from supraspinous fossa, infraspinatus from infraspinous fossa, teres minor from the upper part of the lateral border of scapula, and commonly inserts onto the greater tubercle of humerus. Now, here we can see another muscle. Here we can see one more muscle, that is subscapularis muscle. Which muscle is this? This is the subscapularis muscle. Now, this subscapularis muscle, which is originating from the subscapular fossa from the anterior view, it inserts into LT. What is LT? Lesser tubercle of humerus. Lesser tubercle of humerus bone. And these four muscles together is called as rotator cuff muscle, because it is, as we know, we know that glenoid fossa is shallow in comparison to head of humerus. These three muscles will keep the head of humerus medially, and will increase the stability of shoulder joint. So let's write about these muscles. So let's write about these muscles. The first muscle is supraspinatus muscle. Okay, so supraspinatus muscle is the first muscle of the rotator cuff list. Just a minute, we'll write once again. Supraspinatus muscle. So rotator cuff muscle can be memorized by the mnemonic SITS. Okay, SITS, S-I-T-S, SITS. So in this list, the first muscle is supraspinatus. So supraspinatus muscle arises from medial two-third of supraspinous fossa of scapula. Okay, insertion. If I talk about insertion, the insertion is the insertion of supraspinatus muscle. It is inserting onto the superior facet of greater tubercle of humerus bone. Okay. So this is the first muscle of SITS, rotator cuff muscle. This mnemonic is SIT, S-I-T-S. S for supraspinatus, I for infraspinatus, T for teres minor, and S for subscapularis. Got it? Now let's talk about its nerve supply and action. Nerve supply. If I talk about nerve supply, it is getting innervation from suprascapular nerve. Suprascapular nerve. And if you remember the class of brachial plexus, suprascapular nerve is a branch from the upper trunk of brachial plexus having the root value C5 and C6. Action. As I told you, a very important action of supraspinatus muscle is it is initiating the abduction of arm. So 0 to 15 degree of abduction is done by supraspinatus muscle. So 0 to 15 degree of abduction is done by supraspinatus muscle. That means it causes initiation of abduction. It causes initiation of abduction of arm. Done? Okay. So it's very important that you should be knowing about the action of all the muscles of rotator cuff one by one, because it has been asked multiple times in the theory part also, it can be asked as a short note on rotator cuff muscle as an enumeration question. Also it can be asked in the viva. So it's very important that you should be knowing about these muscle action, nerve supply, attachment. Now it's also important, actually it's a there is soft tissue injury and sometimes supraspinatus muscle tendon is injured, and when it will be injured, initiation of abduction will be hampered. Okay, so there is also that is very important. Basically supraspinatus muscle is commonly injured also because okay, the next muscle will be infraspinatus muscle. So let's write about the second muscle in this list of rotator cuff, infraspinatus muscle. Let's discuss this infraspinatus muscle. Okay, infraspinatus muscle is actually originating from, we have seen in the image also that it is originating from infraspinous fossa. So it arises, origin, it arises from medial two-third of infraspinous fossa. Insertion. So insertion is onto the middle facet of greater tubercle of humerus. Got it? Now talking about nerve supply and action. So nerve supply is similar to that of supraspinatus muscle. That means supraspinatus and infraspinatus both is supplied by suprascapular nerve, which is the branch from the upper trunk of brachial plexus having the root value C5 and C6. So supplied by suprascapular nerve, root value is C5, C6. Action. The action of the infraspinatus muscle is, it is the lateral rotator of arm. So it is lateral rotator of arm. So which is the next muscle of the rotator cuff group? SIT, the teres minor muscle. So let's discuss the teres minor muscle, the third muscle, that is teres minor muscle. The teres minor muscle if I am talking about teres minor muscle, this is originating from the lateral border of scapula, to be more specific, posterior aspect of the lateral border of scapula. So it is originating or arising from, so actually upper again. So lateral border of scapula will give rise to two muscles. Okay. Lateral border of scapula on the posterior aspect, teres minor and major. Teres minor will be above and major will be below. Always minor means children. So children lies above. Always parents keeps children on their head. They will fulfill all their requirements. So minors will be above and major will be below. So origin is as an as a elongated muscle. It arises from posterior aspect of lateral border of scapula. Lateral border of scapula. Now coming to the insertion. So if I talk about insertion, it is inserting onto the lower facet of greater tubercle of humerus. So inserts onto the lower facet of greater tubercle of humerus bone. Okay. So superior facet, supraspinatus muscle, middle facet, infraspinatus muscle, lower facet, greater tubercle of humerus, lower facet, teres minor muscle. So basically, if I talk about nerve supply, teres minor muscle is another muscle which is receiving nerve supply similar to deltoid muscle, that is axillary nerve. So its innervation is nerve supply. If I talk about nerve supply, it is getting innervation from axillary nerve. And what about its action? The action is, if I talk about action, its action of teres minor muscle is, it is also lateral rotator of arm. So it is lateral arm. Axillary nerve, again the root value is C5 and C6 and it is a branch from posterior cord of brachial plexus. So if I talk about scapulohumeral group of muscle, okay, this was the third muscle of rotator cuff. One more muscle is there, that is subscapularis. So basically subscapularis. That means together we have 6 muscle in the list of scapulohumeral wrist. One is the deltoid. 4 is the rotator cuff muscle, sits supraspinatus, infraspinatus, teres minor and subscapularis muscle. And one more muscle is teres major muscle. Together we have got 6 muscle in this list. So the fourth muscle in this list will be, so we have just now we will also talk about subscapularis muscle, which is important for you to know. The subscapularis muscle. Subscapularis muscle. So subscapularis muscle origin, we have seen in the image, it is originating from the, actually if I talk about its origin, it is the muscle which is originating from the subscapular fossa. So it originates from the costal aspect of the scapula. So it is originating from medial 2/3 of costal surface of scapula. That is also called a subscapular region. And and if I talk about insertion, it is the muscle which is inserting into the lesser tubercle of humerus. So this is exactly inserting. Actually, if I talk about the tendon of this muscle, this subscapularis muscle will be seen in the anterior aspect. This will be seen in the anterior view of the scapula and it inserts onto the lesser tubercle of humerus. So it inserts onto the lesser tubercle of humerus. Okay. Now nerve supply. Nerve supply is via subscapular nerve. What is the nerve supply? Nerve supply is via subscapular nerve. Again, the subscapular nerve is root value C5 and C6. It's a branch from posterior cord of brachial plexus. Action, if I talk about action, it is the medial rotator of humerus. This is the medial rotator of humerus bone. Now done with this, now the next muscle will be, so the last muscle which I want to describe in the scapulohumeral group is the teres major muscle. So this was 4 muscle which I described about rotator cuff muscle. The one we have done is the deltoid muscle. So 4 plus 1 is 5 and the last muscle in this list. Okay. So we will have the other muscle that is the 6th in this list, that is teres major muscle. Let's talk about its attachment. Origin. So exactly if I talk about origin, it is originating from the lateral border of the scapula and it is originating lower to the teres minor muscle. So it arises from the dorsal aspect of inferior angle and lateral border of scapula. Basically it will be lying below the teres minor muscle. Insertion. So if you remember, I told you that in the humerus bone we will have intertubercular sulcus, which is having lateral and medial lip. So basically this is teres major muscle is inserting into the medial lip of intertubercular sulcus, and pectoralis major is inserting into the lateral lip of intertubercular sulcus, and the floor in between pectoralis major and teres major we have got a floor, which is the insertion point for latissimus dorsi. So only it is to memorize, it is told that the lady is lying between two majors, pectoralis major and that of teres major muscle. So insertion will be, it inserts onto the medial lip of intertubercular sulcus of humerus bone. Done. Now coming to the nerve supply. So the nerve supply is from lower subscapular nerve. Lower subscapular nerve. Actually, upper and lower subscapular nerve. Both subscapular nerve are the branch of posterior chord of brachial plexus. That is very, very important for you to know. And its action will be, it's a medial rotator of arm. Okay. So with this, we have finished all the scapulohumeral muscles and also the rotator cuff muscle, which why this supraspinatus, infraspinatus, teres minor and the subscapularis is called as rotator cuff, because these muscles are fusing with the underlying fibrous capsule of the glenohumeral joint, and these are supporting, increasing the stability of shoulder joint. So they are called rotator cuff muscle. They are musculotendinous cuff they form around the shoulder joint. That is an important point. And one more thing, note point I will like to tell. Actually, supraspinatus muscle is commonly injured among all the rotator cuff muscle, and in literatures less importance is given in the literatures to the subscapularis muscle. So only subscapularis muscle by many of the authors is regarded as a forgotten tendon. Okay, so if I talk about SITS, SITS, that is supraspinatus, infraspinatus, teres minor and subscapularis muscle. The forgotten tendon is the name given to subscapularis muscle tendon. Okay, that is important for you to know. Now after that, let's move on to the next group of the list of the muscles. So let's move on to the, so basically I will solve few MCQs along with you, and then we will talk about another set of topics. So a male patient who has already taken the first dose of COVID vaccine comes for the second dose. Okay. The health worker then noticed that his shoulder was flat, flabby, and looked asymmetrical due to loss of contour. Shoulder contour is lost. Which of these structure could have been injured and lead to this case of scenario? So actually, in this case, if I talk about the correct answer, so basically, shoulder is asymmetrical, loss of contour. So we know deltoid muscle is here, and deltoid muscle is forming the shoulder joint contour, and the nerve supply is axillary nerve. So in this IM injection, COVID injection second dose, during IM injection, axillary nerve was injured, and axillary nerve gives innervation to deltoid muscle. So which is the right answer? Deltoid muscle is involved in this case scenario. Okay. Now I would also like to come to one more MCQ which I want you to solve, which is here. Let's solve it. Okay, this question. Can you, attachment on the lateral border of scapula. So which of the following muscle it attach onto the lateral border of scapula, whether it is teres minor, infraspinatus, subscapularis, or long head of triceps? So basically infraspinatus not onto the lateral border. No, obviously no. This is not in the, it is infrascapular, subscapularis, anterior, long and triceps. The correct answer here is the teres minor muscle. Teres minor and major muscle, both is attached onto the lateral border of scapula. So that is the right answer. Now moving to the next set of topic. So basically, in the list of back and scapular region, I would like to tell you about axillary nerve and also about the scapular spaces. Why it is very important? Because scapular spaces also you have to know. And this is asked in the MCQ also, and this can come as a short note also. So it is important that you should be knowing about scapular spaces. So when I'm talking about subscapular spaces or intermuscular spaces in the scapular region, so when you go for the dissection in this list, when you go for the dissection in the scapular region posteriorly, there are intermuscular spaces. Okay, so let me first describe this, and then we can know the boundaries and the content also. So basically there are three spaces, as you can see in this diagram. Let me use my this three spaces. This is quadrangular space. Okay, then we will have this space as upper triangular space, then we will have this space as the lower triangular space. So I have highlighted the three spaces. The quadrangular, I have highlighted the three spaces: the quadrangular space, the lower triangular space, and the upper triangular space. What you have to understand is the boundaries and the structures traversing through this. So one by one, this is the quadrangular, this is the upper triangular, and this is the lower triangular space. Got it? Okay. Now, so basically in this diagram, what you can appreciate, now I will use brown color for the muscles. So we will have following muscles in this list. So this is teres minor muscle. So teres minor muscle, if I just focus on to the quadrangular space, which is shown in the blue color, let me just enlarge this. Just focus on this image, the quadrangular space, which has been highlighted with blue color. So it is superiorly bounded by which muscle? It is superiorly bounded by teres minor muscle. Along with it, this is the posterior view, and on anterior aspect, along with this, we will also have the subscapularis muscle on the anterior aspect. And lower down, you can see the muscle which is bordering it is the teres major muscle. So lower boundary is formed by teres major muscle. Upper aspect of the quadrangular space is formed by which muscle? Teres minor muscle. Got it? And on to the lateral aspect, we will have the surgical neck of humerus. Can you see here? This is the surgical neck of humerus. This is humerus bone, and here we will have the surgical neck of humerus, which is forming its lateral border boundary. Okay, lateral boundary. And what lies on the medial aspect? Medial muscle, the muscle which you are seeing is the long head of triceps. So this muscle is the long head of triceps, which is forming its medial boundary. Clear? Quadrangular space? Okay. Now upper triangular space, very easy. On the upper aspect, upper border teres minor muscle, lower border teres major muscle, and here the long head of triceps will form which boundary? It will be forming the lateral boundary. In the lower triangular space, we will have laterally the shaft of humerus bone. This is the shaft of humerus bone. Medially, again, we will have the long head of triceps, and superiorly, we will have the teres. We have done with the boundaries of all these spaces. Clear? All these spaces boundaries we have done. Now the next important point is to know the structures which is passing through these intermuscular spaces. So let's talk about the structure. So in the quadrangular space, the structures traversing will be one artery and one nerve. Okay, I'm just using this schematic diagram to help you. So the artery will be posterior circumflex humeral artery, and the nerve is axillary nerve, AN for axillary nerve. Now from the upper triangular space, we have got one artery which is traversing through this. The name of this artery is circumflex scapular artery. Circumflex scapular artery. And you know that circumflex scapular artery is a branch of subscapular artery, which is a branch from third part of axillary artery. And through the lower triangular space, we have again got one artery and we have got one nerve. So here artery is profunda brachii artery. What is the artery? Is the profunda brachii artery, and the nerve is radial nerve. Which nerve is this? This is RN for radial nerve. So these are the structures which is traversing through this quadrangular spaces and the upper lower triangular spaces. I would like to make a diagram for you. I have already explained you, but in examination it can come as a short note. So you should know to make the diagram and you should be defining the boundaries. Okay, done with this. I think it's clear. Subscapular spaces. So either we have to make an outline. So you can write the heading intermuscular spaces in scapular region. This can be asked in the Viva MCQs also, and can be asked as a short note also. Can be asked as a short note also. Got it? Okay. Now just to make it, I will make an outline here of scapula. This will be the acromial process. Okay. Oh, why it has gone down. Got it? Yeah. So then here we will make the head of humerus. Just an outline. Okay, just an outline. Okay, humerus bone. This is again a schematic diagram. Okay. Now we know also that means this is the scapula posterior view. Then spine is there. So this is the spine of scapula. This will be the spine of scapula. Okay. Then this is obviously the scapula bone, and this will be the lateral border. So on the lateral border, two muscles are attached: teres minor and teres major muscle. So superiorly, we will make the teres minor muscle. Okay. And lower down will make the teres major muscle. Overlapping to it, we will have infraglenoid tubercle, we will have long head of triceps. So we will have the long head of triceps. Okay. This is like this. This will be coming close. Okay. Got it? So this is just a schematic diagram to make you understand. Somewhat like this. So because we have to make this from this. Okay. Now here we will use brown color for the muscles. Brown color for muscle. So this is the muscle, minor muscle. This is teres minor muscle. This is teres major muscle. Actually, for understanding, these are showing as a gap. When you will see in actual dissection, there will be very small intermuscular spaces, very small intermuscular space. You have to do the dissection very nicely if you want to appreciate these areas, these intermuscular gaps. Okay, got it? Now, so this is exactly so now coming to the labeling part. This is teres minor muscle. This is teres major muscle. This is long head of triceps. Okay, this is the humerus bone. Obviously, this is a humerus bone, no doubt about that. If you want, you can use gray color for the bones. So you can just use gray. Always use gray color for the bony landmarks. Okay, and if you want to use color for the muscles, in anatomy, you have to use brown color for the muscles. Red color for arteries, yellow color for the nerves, and blue color for the veins, and for ligaments and all, you can use green color. Humerus bone. Okay. Now, so we have got the spaces. We can you can just write also. This is quadrangular space. This is quadrangular space. This is the lower triangular space. This space is lower triangular space. Lower triangular space. Okay, this space is lower triangular space, and this space which you are seeing is the upper triangular space. So we can see the three spaces also now in this spaces. So you can highlight the spaces if you want. Okay. Now I will not highlight it because I want to show the content also. So here there is one artery traversing from the quadrangular space. There is one artery which is traversing from the quadrangular space, and one nerve. Okay. So again, this is the artery and this is the nerve. So let's label it now. The artery is posterior circumflex humeral artery and the nerve is axillary nerve. Okay, so these are the two structures which is traversing from upper quadrangular space and from the upper triangular space. From the upper triangular space, as you can see here, the artery traversing will be circumflex scapular artery. Which artery? It's the circumflex scapular artery. So again, these are just schematic diagrams. This artery is circumflex scapular artery. And through the lower triangular space, we have got one nerve and one artery again. So this is, we will have the artery here and we will have the nerve. The artery is profunda brachii artery and the nerve is radial nerve. Okay, so this is the diagram showing the boundaries and the content of quadrangular upper and lower triangular space. Already described the boundary, and here also if you want you can just this is the quadrangular space which I have shown in blue color. Okay, so bounded above by teres minor, below by teres major, onto the medial side long head of triceps, onto the lateral side surgical neck of humerus. Now if I talk about the boundaries for the upper triangular space, it is above there is a teres minor, below is teres major. The structure traversing is circumflex scapular. And if I talk about lower triangular space, it is above by teres major, medially by long head of triceps, laterally by shaft of humerus. Structures traversing profunda brachii artery and radial nerve. So clear? Okay, it can come as an enumeration questions and quickly write down the structures and the boundaries. Okay. So let's firstly start with the quadrangular space. As I have told you, quadrangular space is bounded superiorly by teres minor muscle and by subscapularis muscle. Now, my dear students, teres minor muscle will be lying posteriorly, because posterior aspect, and subscapularis muscle will be lying on the anterior aspect. As the image is made from the posterior view, so we can see only teres minor muscle. What is lying inferiorly? Inferiorly, it is bounded by teres major muscle. And on the medial side, it is bounded by long head of triceps. And on the lateral aspect, it is bounded by surgical neck of humerus. Okay. So this is about the quadrangular space boundaries. We can see its overall boundaries as in described in this diagram also and shown here also. This is the boundary for quadrangular space. And the structures traversing, those structures passing through the space. Structures passing through this space. If I talk about the structures passing through this space, we have two structures which pass through quadrangular space, and they are posterior circumflex humeral artery and axillary nerve. Vetter-Werther's vessels because both artery and vein and axillary nerve. Actually, around surgical neck of humerus, there is anastomosis between anterior and posterior circumflex humeral arteries. Now let's talk about upper triangular space. Upper triangular space. Okay, let's talk about upper triangular space. So if I talk about upper triangular space, its boundaries are superiorly, it is bounded by teres minor muscle. Teres minor muscle. It is bounded laterally by long head of triceps, and it is bounded inferiorly by teres major muscle. Now structures passing through this gap. Structure passing through this space. That means upper triangular space. We have just one structure which is passing, and the name is circumflex scapular artery, which is a branch of subscapular artery, which is a branch of third part of axillary artery. Which artery passes? Circumflex scapular artery passes. Now coming to the lower triangular space. So whenever you go for dissection, please clear the structures nicely and delicately on the posterior aspect of scapula so that you can get these spaces and you can appreciate the structures lying and passing through these spaces. Lower triangular space. So if I am talking about lower triangular space, its boundaries are, it is bounded medially by long head of triceps. It is bounded laterally by shaft of humerus bone. And it is bounded superiorly by teres major muscle. Teres major muscle. Got it? Now coming to the structures passing through this space. Structures passing through this space. So if I talk about structures passing through the space, we have got two structures which is passing through the space. One is radial nerve and the other is profunda brachii artery. Profunda brachii artery and vein. Got it? Profunda brachii artery and vein. So we have done with this. Now, I just want you to show a cadaveric image This is the dissection being done in, and you can appreciate the scapular spaces. So this is actually always the spaces can be visualized when the arm is abducted. So here you can see, I would like to highlight, this is the teres minor muscle. This muscle is the teres major muscle. So, and this muscle which you are seeing is the long head of triceps. Okay. So this space, so here we will have this space is the quadrangular space, which is bounded by the following muscles: superiorly teres minor, inferiorly teres major. Here we have got the surgical, we have got the humerus bone. This is the surgical neck of humerus and the long head of triceps medial. In upper triangular space, we have got, in this upper triangular space, superiorly we have got teres minor, inferiorly we have got teres major, and long head of triceps laterally. So obviously this is the minor one, teres minor one. This is teres major, and we have got the triceps muscle long head. And lower triangular space is bounded by humerus bone shaft laterally, by teres major above, and medially by triceps long head. So this is how, if you go for dissection, this is how the scapular regions on the posterior dissection looks like. And you can identify the quadrangular, the upper and lower triangular space. And you can also visualize the structures traversing through it. Done with this. Now the next topic is axillary nerve. So in the scapular and back region, scapular region, it is important that you should be knowing about axillary nerve. So if I talk about axillary nerve, it's very important that you should be aware of this axillary nerve. And I think you are already knowing about axillary nerve, and you know that axillary nerve is having the root value C5 and C6. It's a branch of posterior cord of brachial plexus. So axillary nerve arises from posterior cord of brachial plexus. Okay. And it arises near lower border of subscapularis. So basically it arises, if I'm talking about, it arises near the lower border of subscapularis muscle. Okay. Now, if I talk about axillary nerve, it runs backward on the subscapularis muscle and it passes through quadrangular space. We have seen also. So actually we will talk about its origin and course in brief. We will talk about origin and course of axillary nerve in brief. So now we are knowing that it is arising from posterior cord of brachial plexus, having the root value C5 and C6. It arises near the lower border of subscapularis. Thereafter, it will traverse through which space? Quadrangular space. So it will run backwards on the subscapularis muscle to pass through the quadrangular space. So it will pass through the quadrangular space along with which artery? Along with posterior circumflex, humeral artery. Okay. And in this location, it is lying very close to the surgical neck of humerus. One of an important note point is that the axillary nerve at this location lies close to surgical neck of humerus bone. So only in case of dislocations and damage or fracture of surgical neck of humerus, the axillary nerve is damaged, leading to axillary nerve injury leads to the paralysis of deltoid muscle and teres minor muscle. So here it is lying very close to the surgical neck of humerus, and it is related to the capsule of the shoulder joint inferiorly. The nerve is actually in this location, axillary nerve is giving branch to shoulder joint. Okay. So now after that, so moving on. So here I will just show you, this is the axillary nerve. It is actually passing through the quadrangular space as been shown here. This is the axillary nerve, and this is giving innervation to deltoid and teres minor muscle. These two muscles, deltoid and teres minor muscles. Okay. So here it is traversing in the quadrangular space, axillary nerve. Now we will make a diagram also. Before that, I just want you to show that when it was running laterally, so basically when it was related to the shoulder joint and running laterally, after that, after giving a branch, so axillary nerve gives a branch to shoulder joint. So we are subsequently proceeding with the course. Okay, so I have told you the course till the level where it traverses in close association with the shoulder joint and surgical neck. Here it gives a branch to shoulder joint and then runs laterally to divide, into anterior and posterior division. Anterior and posterior division. You can say anterior or posterior division of branches. Now let's talk about further course. So posterior division gives a branch to teres minor muscle and the posterior part. So please note down further course. You can say posterior division. If I talk about posterior division or posterior branch of axillary nerve, the posterior branch or division supplies teres minor muscle. It supplies teres minor muscle and also posterior part of deltoid muscle and posterior part of deltoid muscle. And here it also travels posteriorly and give upper lateral cutaneous nerve of arm, and it also gives upper lateral cutaneous nerve of arm. Okay, it gives upper lateral cutaneous nerve of arm and supplies the skin on the lower half of the deltoid muscle. Now the anterior. So this was about posterior division. Now let's talk about anterior division. Anterior division. If I talk about anterior division, of axillary nerve, this will continue horizontally. It will continue horizontally between deltoid muscle, and surgical neck of humerus. So this is surgical. This is exactly surgical neck of humerus. So coursing in between the deltoid and surgical neck of humerus, exactly, it is actually it is traversing, and it will also supply deltoid muscle and give innervation to deltoid muscle and overlying skin Now one more point I just want you to note down, that is very important for your MCQs also. This is about anterior division. If I talk about posterior division, it will supply teres minor and that of deltoid muscle. This is the posterior division of axillary nerve. Now it will also have pseudoganglion. So basically, I just want you to tell that the nerve to teres minor is having pseudoganglion. So this is an important note point which you can write as a note point here itself. You can write down. Please write down as a note point. Branch to teres minor, which is from the posterior division, possesses a pseudoganglion. Got it? Now, so we have done with the course and origin of axillary nerve. That was important for you to know. This we have done. We can draw a diagram and flow chart to explain this. If axillary nerves comes as a short note, then you have to write everything. So we can just we can make this diagram. So I will make a diagram and also a flow chart which will complete the whole topic of axillary nerves. Okay, that is important for you. Okay. Okay, so we can just make a diagram. So for that, You can just do a this is a section cut point of humerus bone. Okay, this is cut point of humerus bone. Got it? And we will draw here axillary artery, which is giving two branches close to it. Okay. Got it? So here we can use red color for highlighting this axillary artery, anterior and posterior circumflex humeral artery. So you can just use red color for the artery. So it's surgical. So this is again a schematic diagram showing you the important structures. So around the surgical neck of humerus, what two arteries we have got? We have got the two arteries which is forming anastomotic network, which is anastomosing with each other. That is anterior and posterior circumflex humeral artery. So which artery is this? This will be anterior circumflex humeral artery. And this will be posterior circumflex. This will be axillary artery. And this will be posterior circumflex humeral artery. Got it? Now we can make a bulky muscle, that is the deltoid muscle. So we will just, okay, this is the muscle, that is the deltoid muscle. This is the deltoid muscle. So I'm using brown color for the deltoid muscles. Okay, just said it what? Use brown color for the muscles. Got it? Deltoid muscle. If you want to border it nicely, you can border it nicely. Okay, this is just a deltoid muscle. Okay, so this will be the deltoid muscle. Now, what I have told you, in between surgical neck of humerus and deltoid muscle, the nerve which is traversing is axillary nerve. Now I am using yellow color to make the axillary nerve. So then we will make an axillary nerve which is passing through it, giving branches to deltoid muscle. Okay. So basically, it gives, if I talk about the axillary nerve, this will be the axillary nerve. It will have posterior and anterior. So I will make the posterior branch here itself. The posterior branch is giving nerve to teres minor muscle, which will be having pseudoganglion. And it will also give innervation to the posterior part of the muscles. And it will also give the upper lateral cutaneous nerve. Okay, now let me use this is the pseudoganglion. I will label it all, don't worry. Okay, so just okay. Now, so this will be exactly the axillary nerve. This will be posterior branch. This will be the posterior branch of axillary nerve, which, and you can see this is nerve to, this is the nerve to teres minor muscle. This is nerve to teres minor muscle. And my dear students, you can see this is having pseudoganglion. Okay. And here you can see deltoid muscle, which is getting innervation from both anterior and posterior division. And here we will have this as the anterior division. This is the anterior division or anterior branch of anterior division or anterior branch of the deltoid muscle. Okay. And obviously, if we are talking about the posterior division, it is also giving a cutaneous nerve that will be the lateral cutaneous nerve of. So this will be the lateral cutaneous nerve of. This is exactly giving branch to deltoid. This will be lateral cutaneous nerve of arm. Which one? Upper lateral cutaneous nerve of arm. Okay. So this is a horizontal section in which you can see that the axillary nerve traversing in between surgical neck of humerus. Its posterior branch is having pseudoganglion when it supplies to teres minor. Deltoid muscle is receiving innervation from both anterior and posterior division. And you can also see that axillary nerve is running close to posterior circumflex humeral artery along the surgical neck of humerus. That is a very important point which you have to note down. Okay. So here we can see the anterior branch. Also we can see the anterior branch, we can see the posterior branch, and we can see the branches given to the deltoid muscle. So done with this. And we can also, this is about a horizontal section showing in short about the course of axillary nerve. I would also make a flow chart. So actually you can have, if time is less, you can just draw this flow chart showing axillary nerve. So this is, you can draw like C6, C5, C6, join it like this. What will it form? It will form the axillary nerve. So what is this? This is the axillary nerve. Label it axillary nerve. And this axillary nerve is giving a branch to shoulder joint when it is traversing close to the surgical neck of humerus, and it divides into two divisions. What is it? The anterior and posterior. So basically deltoid muscle is the muscle which is getting innervation from both anterior and posterior division or branch of the axillary nerve. Okay, so you can just here you can use brown color for the deltoid muscle. This is a schematic diagram. So you can see deltoid muscle is receiving innervation from both anterior and posterior. So this is the anterior division of axillary nerve, and this is the posterior division of axillary nerve. Got it? Now posterior division of axillary nerve is also giving, so basically it is giving a pseudoganglion, and it gives innervation to, it gives innervation to a muscle. Which muscle it is giving innervation? It is giving innervation to teres minor muscle. So it gives innervation to teres minor muscle, and the posterior division will continue as upper lateral cutaneous nerve of arm. So what is this? This is upper lateral cutaneous nerve of arm. My dear students, very important for you to note down that upper lateral cutaneous nerve of arm is a branch of axillary nerve. Lower lateral cutaneous nerve of arm is a branch from the radial nerve. Okay. And this will give innervation to, this will give innervation to. This is not ganglion. This is just, okay. And if I talk about the about this anterior division will give innervation, also innervation to the skin over lower half of deltoid muscle, lower half of deltoid muscle. So this is in short in which you can describe about axillary nerve in the form of flow chart. This is in short to describe axillary nerve in the form of flow chart. This is the root value. Axillary nerve is formed from ventral rami of C5, C6. So done with this. Now, if I talk about its clinical aspect, axillary nerve is damaged in inferior dislocation of shoulder joint because it is lying close to the surgical neck of humerus, and the fracture of surgical neck of humerus will lead to the injury to axillary nerve, leading to the paralysis of deltoid muscle and teres minor muscle. So let's talk about clinical anatomy. Clinical anatomy related of axillary nerve. So first one is injury to axillary nerve. So injury to the axillary nerve occurs, if I talk about injury to axillary nerve, it occurs in the inferior dislocation of shoulder joint. Also, it is injured close to surgical neck of humerus, fracture. And what will happen? It will lead to the impaired. So here what happens? It will lead to the paralysis of two muscle. Which two muscle, my dear students? Deltoid muscle and teres minor muscle. And you know that teres minor muscle is having the function of lateral rotation of arm. But lateral rotation of arm is also done by infraspinatus muscle. But abduction of shoulder joint 15 to 90 degree is done by deltoid muscle only. So this will lead to the paralysis or impaired abduction of shoulder joint. So that means when deltoid muscle is injured, it will lead to impaired shoulder abduction, because prime abduction of 15 to 90 degrees is done by deltoid muscle. Teres minor muscle is affected, so slight lateral rotation is also affected, but we have got another muscle which can still laterally rotate the arm. Okay, so this is an important, in long lasting case of injury of axillary nerve and deltoid muscle, atrophy can also happen and there will be loss of shoulder contour. Now also the second point is loss of sensation. Loss of sensation over lower half of deltoid muscle, lower half of deltoid muscle. So there will be loss of sensation of lower half of the deltoid muscle, and this is due to so basically deltoid muscle, upper lateral cutaneous nerve of arm is not working, and there is loss of sensation on lower half of deltoid muscle. This sign is called as regimental batch area. So this sign is called as regimental batch area because of loss of sensation, in the lower half of deltoid muscle due to involvement of upper lateral cutaneous nerve of arm. Okay, due to involvement of upper lateral cutaneous nerve of arm. The third important point is in long lasting case of axillary nerve injury or deltoid muscle atrophy, it can lead to loss of shoulder contour. So these all abnormalities are related with axillary nerve injury. Okay, these are all abnormalities which is related with axillary nerve injury. So done with this. Okay, so with this we come to the end of the session. Let me ask the students if they have got any doubt, they can ask me. Okay, Okay, dear. Do you yes, I will continue. Okay, yes dear, I will continue taking the session. Okay. Okay, dear. So basically, it is important that you should, at the end, to summarize everything, whatever things we have completed. We have covered the scapular region, we have covered the back muscle, we have covered the important intermuscular spaces, we have seen the structures traversing through this intermuscular spaces, the quadrangular space, the upper triangular, the lower triangular spaces. So what I want, that you should be aware of boundaries, you should be knowing about the muscles attachment, and you should be knowing about the structures traversing. So this is, all of you please present live, and you should be writing all the notes and making diagrams along with me, so that it help you to understand the subject. Okay. Okay, dear. So we will meet again for the next session. All the best and keep studying. Okay, any doubt you can ask me live in the session. So we will as we are coming to many of the topics of upper limb has been done, so I will cover up the upper limb and then we will start with the thorax region. All the best and keep studying. Thank you so much. We'll meet in the next session. Thank you so much.